Welcome to Thursday's edition of COVID-19. The world has marked yet another milestone. The global tally of infections has surpassed 30 million cases. In a span of 18 days, cases worldwide rose by 5 million. Meanwhile, here in Korea, cases continue to hover within the 100 range. We start the program now with the latest numbers on the pandemic with our Kwon So-ah and related news with our Yoon Jung-min. So here we have yet another rise in daily tally here in Korea. Do tell us more.
Yes, Sunny. Over 150 new cases were confirmed. That's more than 40 compared to yesterday. And this is due to outbreaks at various new locations, such as a major auto plant, a wedding consulting firm, as well as a mental health care center. And on top of that, chain transmissions from existing clusters are also rising day by day. So while daily cases have stayed below 200 for the past 2 weeks, it's taking some time for those numbers to get down to the double digits. And also a concern is that in the past 2 days, we're actually seeing an increase in cases. Meanwhile, 124 cases occurred in the metropolitan region. In total, we have 153 cases this Thursday, and 5 deaths were reported, raising the death toll to 372. Some 2,700 people remain in quarantine, and over 19,500 people have made a full recovery from the virus. Now let's move over to our map. We see 63 cases in the capital, 54 in Gyeonggi-do province, 7 in Incheon. As I said, more than 100 in this metropolitan region alone, but also in many other parts of the country, we are seeing sporadic infections. And also 8 cases were reported from overseas this Thursday.
Right, so now, as I mentioned at the start of the program, we've marked yet another grim milestone on the international front. Tell us more about that.
Sure, Sunny. Global cases of the virus topped the 30 million mark. And that happened 9 months after the first outbreak in China. And also what's a concern is the fast spread of the virus. In the past 18 days, 5 million cases were reported. And that brings the total to over 30 million, as I said. But again, some more were added in the past hours, with over 308,000 cases reported in just a day, over 6,000 new fatalities, but also some 261,000 recoveries. And out of the 30 million cases we're seeing, 20 million emerged in the top 10 countries with the highest numbers of infections. The US, 6.8 million cases, and many Latin American countries we're seeing here, with the WHO saying that they are reopening too fast. And India had over 97,000 cases in the span of just a day. Meanwhile, France has surpassed the 400,000 mark, and we also see Iraq has surpassed 300,000 cases in total. And those are the updates I have for now, but I'll be back with more after the afternoon briefing. Sunny?
Right, so thank you for that. Right, here on the local front, authorities are actively seeking to drop the daily tally of infections to the double digits. I have our Yoon Jung-min here in the studio with me for more on those efforts. Welcome, Jung-min.
Hello, Sunny.
Right, now I hear civic groups are planning a mass rally for the first weekend of October, despite words of encouragement from authorities. Tell us more about that.
You're right, Sunny. So the government is doing its best to put prevention measures at the forefront. Prime Minister Chung Se-kyun warned that the government will take a zero-tolerance policy amid talks of another mass rally on October 3rd, which is National Foundation Day. Take a look.
We urge people to cancel their plans for a mass rally. If they go ahead with the gathering, I say once again that the government will take stern action under the law to protect the lives and safety of our people.
Chung said that Korea has paid a heavy price due to the resurgence of COVID-19, partly fueled by a massive anti-government rally on National Liberation Day. The Prime Minister added that although the country has seen fewer new infections in recent days, it's too early to let our guards down because small cluster infections are still being reported nationwide.
Indeed, cluster infections do continue. Let's turn now to the containment efforts ahead of the Chuseok holiday, Jung-min.
Sure, Sunny. So the authorities unveiled its latest measures for the holidays. From September 30th to October 2nd, the government will collect fares at expressways. They used to be free during major holidays like Chuseok to accommodate those who travel to their hometowns to visit their families. But this year, the government is looking to limit the movement of people amid the pandemic. Take a listen.
Expressways used to be free during the holidays since 2017, but we've decided to collect toll fares this year to limit large-scale movements and prevent a resurgence of COVID-19.
Having designated the holidays as a special antivirus period, the government is asking people refrain from traveling this Chuseok and avoid places where many people gather. It will soon announce detailed guidelines on preventive steps, but people in Korea are already taking part in measures to protect themselves and those around them. Many elderly citizens are encouraging their children not to visit during the holidays this year for the safety for everyone. Take a look.
It's dangerous because of COVID-19, so dear children, you don't need to come visit. I'll see you next year instead. It's unfortunate, but we can't help it, and we all need to stay safe. See you next time.
Instead, many people say they intend to have lengthy phone calls with their parents living in the countryside and send them more gifts this year.
Well, words of gratitude alone can go a long way this holiday season, especially in light of the pandemic, that is. Let's turn now, Chongmin, to the academic arena. How does the government plan to manage the reopening of schools next week?
Sure, Sunny. So with the social distancing measures having been eased, schools in the Greater Seoul area are resuming in-person classes starting from next Monday. For kindergartens, elementary and middle schools nationwide, they can run classes at 1/3 of their capacity and 2/3 for high schools. The rules will be applied until October 11th. The government will allow certain types of institutions to hold classes at their own discretion. Those are special education schools, schools with fewer than 60 students, and those in rural areas. The Education Ministry will discuss later on whether to allow more students at schools after October 12th. Take a listen.
We need to discuss this issue with health authorities considering the COVID-19 situation. If we can successfully apply prevention measures during the Chuseok holiday, we can expect more in-person classes to resume after October 12th.
The Education Ministry says it will provide online monitoring and feedback using video conferencing platforms and social media services.
Now, Chongmin, what's the latest on flights to and from countries abroad?
Sunny, so although the world is still in crisis, South Korea is continuing to maintain its exchanges with foreign countries with strict preventive measures in place. So for the first time in 8 months, flights from Incheon to the Chinese city of Wuhan resumed this week. Korea's T-Way Air reopened its routes to and from Wuhan starting from Wednesday. This comes as local air carriers suspended flights to Wuhan back in January when the city was locked down due to the coronavirus outbreak. Also, Korea's foreign ministry is working to expand its fast-track entry system for essential business travelers. That means quarantine rules will be eased for business people as long as they have been tested negative for COVID-19. Such arrangements have already been made with China, the UAE, Indonesia, and Singapore. This morning, Korea's Foreign Minister Kang Kyung-hwa left for Hanoi to discuss implementing fast-track measures with her Vietnamese counterpart.
I see. All right, Chongmin, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular afternoon briefing on COVID-19 here in this part of the world. Compared to the start of this week, Korea has been noting a slight rise in daily cases. As Soa mentioned earlier, we have 153 infections today, and we've also lost 5 lives as well. Authorities are forecasting a further rise in the number of fatalities, as the number of those in serious and critical conditions stands at 160. Now, back in mid-August, that number stood at 9. What's more, most of those who tested positive recently are in their 60s or older. In fact, according to the Korea Disease Control and Prevention Agency, roughly 40% quarantined for treatment over the past 2 weeks are in that age group. Against this backdrop, 1 out of 4 cases cannot be traced, raising fears of the possibility of more sporadic cluster infections. Meanwhile, as our Yoon Jung-min mentioned, schools in Seoul, Incheon and Gyeonggi province are poised to welcome scholars back to classrooms starting next Monday. To minimize the risk of infection, kindergartens, primary and middle schools will keep the attendance level in each class to 1/3, while high schools will keep that rate at 2/3. The only exception to this rule are seniors, classes for seniors that is, which are not subject to these restrictions. We are still waiting for the briefing to commence, and while we wait, let's take a look at the guidelines under Level 2 social distancing, which is in effect across the country. Gatherings of more than 50 indoors and 100 outdoors remain banned. Professional sports games can take place in the absence of spectators at stadiums. Operations at high-risk establishments, including buffet restaurants, clubs, bars, singing rooms and cram schools of more than 300 people remain suspended. Internet cafes, however, have been removed from that list of high-risk venues and are allowed to open but cannot accommodate minors nor serve light meals. The ban on in-person religious activities remains in place and no visitors are allowed at the homes for the elderly. Remote working is strongly advised under Level 2 social distancing. The briefing is yet to start, so we'll take a look at today's numbers for Korea. On this Thursday, that is, we have 153 infections, as our Kwon-Soa mentioned, raising our total number of infections for this Thursday to 22,657. We've lost 5 more lives, raising our death toll to 372. As mentioned earlier, authorities expect this figure to rise in the coming days as we have a greater number of people in serious and critical condition. That would be 160 to be precise. The briefing is about to start. We'll come back to you afterwards with a summary.
설명이 있겠습니다. Let
us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 17th, Thursday, we have 145 new local infections and 8 new imported cases. The total caseload now stands at 22,657. Currently, 2,742 people are in quarantine undergoing treatment, and as of today, we have 160 patients with severe or critical conditions. Unfortunately, we have lost 5 lives as of yesterday, and I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at our major updates on domestic infections. In relation to the August 15th Seoul rallies, we have 19 more new cases, and in total, we have 604. So in detail, in Daegu, we also have, in relation to health supplements business seminar, we have seen additional chains of transmissions which has spread to Cheonan area and also in Chungbuk region as well. In Jincheon Nursing Hospital, 3 have been confirmed, and in relation to these 16 people, they have been reclassified, and in relation to this specific group, we have 58 cases to date. In relation to the Severance Hospital in the Seodaemungu district, Seoul City, we have 14 additional cases being confirmed. In total, we have 46 cases being confirmed to date. And in relation to a family in Goyang City, and we have found that this has been the chains of transmissions stemming from the Severance Hospital while providing care, and we have been reclassifying this case under the Severance Hospital case. And in relation to Nambu Church in Bucheon City, we have the first case of the index case on the 10th of September. We have 15 cases being confirmed to date. And in relation to Kia Automobile Plant in Gwangbyeong City, we have also additional cases being confirmed. 11 cases have been confirmed to date. And in Gyeonggi-do Province, in relation to a mental disease service center in the Goyang City, we also have additional cases, and we have seen 3 of the staff members. In total, we have 11 cases being confirmed. In relation to the daycare center and service center for the disabled in Seongnam City, we have 8 people being confirmed additionally, and in total, we have 9 cases to date. In Chungnam City, Chungnam area, in Poryang City, we have the marine school, and we have 4 additional cases being confirmed, and 5 cases have been confirmed to date in total. And as for the imported cases, today we had a total of 8 new imported cases. 5 of them were South Korean nationals, and 3 were foreign nationals. And as for the countries, 4 were from Uzbekistan, and they were also people from Philippines and Indonesia. And currently we have 160 patients with severe or critical conditions by age group over the age of 60. We have 137 patients, accounting for about 86% of the total, and by the fatality rate over the age of 60 account for about 93.8% of the total, meaning that we have higher risks of developing into severe symptoms if they are over the age of 60, and we have a higher fatality rate for those over the age of 60. And as for the hospitals and the care centers for these elderly citizens, we would like to make sure once again that these managers and staff members need to comply with quarantine measures. And recently we have seen large infections across these medical hospitals and nursing hospitals, especially through professional caregivers and staff members. So we ask for these people to refrain from going to multi-use facilities and high-risk facilities, and also minimize physical contact with others, and postpone or cancel your gathering plans or travel plans. And if you feel symptoms, please get tested as soon as possible. And when you are working, please also abide by quarantine measures, including wearing a face mask and washing of your hands. And as for the managers of these facilities, we ask you to have a strict control on the visitors. And lately we have seen many people who have been visiting the health clinics and hospitals. So under the COVID-19 pandemic, please refrain from visiting patients at the hospitals, and also communicate through remote means. And as for the multi-use facilities, and as for the belongings that are shared, like wheelchairs as well as frequently touched surfaces, we need to disinfect these areas frequently, and the ventilation is also very crucial for these facilities as well. And as for the inpatients or patients, if they have symptoms, please get them tested as well. And we have also seen large cluster of infections spreading through asymptomatic patients, and also we have also notified the fact that we are covering the COVID-19 testing fees for inpatients through the National Health Insurance, so regardless of symptoms that is. And so we would like to ask you to preemptively test all of the people who are newly admitted to the hospitals. And as for the summer holidays and the school vacations during August, we have seen clusters infections through travel groups as well as small family gatherings. And our investigation shows that we had 13 cases which have been in relation to these tours and travel, and they have also spread to 14 cities and provinces nationwide, infecting more than 300 people. So we are seeing very diverse forms of groups among families and also travel mates, and also they joined in dining together, and they did not wear face masks at certain times. So if there was just one person who was infected, the virus also spread to many other group members as well. So please note that meeting with other people aside from your family could expose yourself to the virus. So please take a note of that. And at a time when COVID-19 is being prolonged, we ask you to refrain from going to non-essential travels or gatherings, and also wear face masks at all times when you are at restaurants or cafes, and minimize your stay time at these facilities. And during the next Chuseok holidays, we are also advising all of the people to continuously abide by the quarantine measures as we have higher risks of infection. Please refrain from visiting your hometowns and relatives as well. We have additional announcements for the public. Globally, the COVID-19 patients globally have surpassed 30 million as of September 17th. This shows that we are seeing continued incline of the new cases, and many countries are exerting their full efforts to curb the further spread of the virus and flatten their curves. However, the situation is out of control in many countries, and we believe that it is very difficult for us to expect a day of easing and fight and to an end of the COVID-19 pandemic. And we believe that we will have to battle against the virus for a prolonged period of time. So we have been exerting our full efforts to notify the public that the mask wearing is very important. And this is being dubbed also as a self-vaccine. And we also seen many news reports about the effectiveness of face masks as well. And in Daegu as well, out of a health supplement seminar, 27 people were gathered in one place. However, 26 people were infected in this meeting. However, just one person was not infected. We have confirmed that this person was wearing face masks at all times when he or she was at this seminar. And we have seen such an interview with a local press. And this shows that the face masks is very important to prevent infections, especially at a time when we do not have an effective vaccine or therapeutics against the virus. So once again, face mask is a self-vaccine that you could have against COVID-19. Currently, level 2 social distancing is being imposed nationwide. Currently, and as of today, we also saw a slight uptick in the number of new cases, and we also have the continuous on-day increase hovering at the 100 range. And please note that our society is not yet safe from the COVID-19, and please stay vigilant to save your own safety as well as those of your loved ones. And as for the restaurants and other multi-use facilities, please wear your face mask at all times when you are at these facilities. And even when you are at 3C environments, please wear your face masks at all times. So wearing face mask and keeping healthy distance and washing your hands can keep yourself and the community safe. The quarantine authorities will also exert our full efforts. Thank you very much.
Right, that was Chong Young, the Commissioner of the KDCA, with Thursday's afternoon briefing. So, what was the gist of her address today?
Well, let's start with some updates on new cluster infections. There were at least 11 cases confirmed to a plant of Kia Motors, and the number of people linked to the August 15th rally has surpassed 600 with 19 new cases. And also cases linked to the Severance Hospital in Seoul added some 14 new cases. There were also other new infections at churches, high schools, and welfare centers. And speaking of welfare centers, those are often visited by elderly people. And according to Tong, some 85.6% of people in severe or critical condition are people aged 60 and above. That's why she asked for those people to minimize their contact with others and not go to multi-use facilities.
Right. Okay. So thank you for that. I'll see you again tomorrow.
See you tomorrow.
On the international front, we turn our attention to Italy, where authorities have opened up the academic arena. I have Dr. Michele Usuelli, who is also the councillor of Italy's Lombardy region, live on the line. Hello, Dr. Usuelli.
Hello, thank you for the invitation.
Right, Dr. Usuelli, when we last spoke about, I think, 3 or 4 months ago, schools in Italy were closed. But as of this past Monday, they've opened doors. What measures are in place within the academic arena to ensure the safety of the faculty and the student body?
Yeah, since last May, the end of the lockdown, we have experienced, Italy did very well its homeworks, so now we have a very low prevalence rate nationwide. Even August was a big holiday time. We experienced just a slight increase of the cases. So now we open the school. All the students are in class with distance and preventive measures. We have a good protocol of case detection. Like, let's say a child who develops fever in school immediately receive the testing, and if it is positive, all the classmates go in quarantine and get tested. The idea is to send the doctor with the rapid test in the school, so after 30 minutes you can have the result. It's not yet clear the monitoring system that we have to put in place, because most of the children will be asymptomatic even if infected. And we try to suggest the government to use the pooling of the test, to combine the test of all the students in the class in one single test. They test one, and if it is negative, it means all the class is COVID-free. This is still on the debate of the agenda, but I think it's interesting.
I see. Meanwhile, Dr. Ussoli, I hear that cases of COVID-19 are on a resurgence in Italy. What efforts are being made on a national scale to contain the latest outbreak?
Well, look, now we hospitals are more empty. It is now the moment to start the follow-up and study those who recovered. In the beginning, the issue was just surviving or not. Now we need to study, and we are doing it, the long-term consequences of the infection. Sometimes we see side effect of not a proper mechanical ventilation on the lungs of our citizens. Just because we didn't know how to ventilate properly the lungs, it was a new disease. Then we have long-term side effects on heart and lungs according to the age, according to the previous diseases, and also according to the period when our citizen got infection. Those who got infection in the beginning, they are likely to have more long-term side effects because our doctors didn't know very well how to treat them, while those who were infected in the second stage, our doctors were more experienced learning from their patients, unfortunately, and so we are seeing less side effects. It's important to have studies published and to share with our international colleague the outcomes of this.
Dr. Ussoli, talking about those infected the second stage, former Italian Prime Minister Silvio Berlusconi also this past Monday left hospital after battling COVID-19. Now, considering his age, which is about 83 years, and his pre-existing health conditions, including heart problems, his story is no doubt a rewarding one for healthcare workers and perhaps a story of hope for those whose loved ones are still at the hospital. Generally speaking, do such stories have an impact on Italy's containment efforts?
Well, first of all, let me say that I'm very happy for Silvio Berlusconi. He's my opponent, he's never my enemy, so I'm very happy that he recovered. I hope that he will not have long-term consequences. As we just said before, and as you said, he is a chronic disease patient and is quite old. Well, let me say that nowadays, after so many months, our community already fully understands that is serious, that it's important, and that now the mortality rate dropped dramatically, luckily. And so I think Silvio Berlusconi has been considered just as a normal citizen by our community. So we are very happy for him, and we are reassured by the fact that, of course, he went to a big private hospital, but the standard care that he received, it is not very much different from the standard of care that humble people and poor people can receive in Italy. So that is reassuring.
Right. Dr. Usuli, one final question. I understand Italy is poised to hold regional and local elections which had been postponed from May owing to the pandemic. Granted, Korea was fortunate enough to hold its parliamentary elections back in April amid the pandemic. What preparations are being made to guarantee a safe voting process in Italy?
And we have also a national referendum, so it will be also for all the population. I think election is one big part of our democracy, and it's very important, as well as going to school, as well as going back to work. So people are prepared to do it with social distancing, with masks. We increased the number of days where people can vote, so the amount of people are diluted into days. And it's just a part of our life. We need to learn to live and deal with the virus, also continuing to go to vote, because democracy, you can't give it for granted. It's something that is valuable and precious.
Of course. All right, Dr. Usuli, thank you yet again for being with us today with your thoughts at this hour.
Thank you very much. Greetings from Italy to all the people of South Korea.
Thank you. China's tale of triumph against COVID-19 was made public earlier this month. President Xi Jinping conferred medals on those believed to have played crucial roles in the fight against the virus, which was first reported in Wuhan last December. For more on the medical and political implications of this claimed victory, I have Professor Chu Jae-woo from Kyunghee University. Welcome, Professor Chu.
Thank you.
And I also have Dr. David Kwak from Soonchuneng University Hospital. Pleasure to have you back, Dr. Kwak.
Good afternoon.
Dr. Kwak, we'll begin with you. I believe it was on the 8th of September that China declared an end to the pandemic in its country. Prior to this, back in May and in June, I believe, we had Slovenia and New Zealand making same declarations, respectively. Is there a universal criteria for declaring an end to the pandemic, or do these standards differ depending on the country?
Well, I don't think there is a universal criteria to declare the end to the pandemic. And in my personal view, in the cases of Slovenia and both New Zealand, I think they declared it a little prematurely. Because just coming into the studio, I checked and I saw that the numbers for Slovenia was rising up back to 2 digits, possibly in the 70s area. And also in the case of New Zealand, they had a huge resurgence verge that they had to control, and they had to sort of put in a whole country in a lockdown mode to bring it back to the levels of 1s and 2s now. So I think this is more of becoming of a global matter, that if one country declares that they won the battle against COVID-19, it's really not going to last that long, because some people from the outer countries is still going to come in with certain but virus infections. So we really have to watch very closely for as a global matter, but not just one country matter here.
Right. Well, claiming that the country had no domestic cases for about a month, 22 days to be precise, the Chinese leader hailed success against the pandemic. Speaking within your capacity as a doctor then, what are your thoughts?
Well, we saw, from Korea. We had a case where 5 passengers flying over from China to Korea were actually diagnosed with a confirmed case there, even after Xi Jinping's declaration that they won the battle against. And also, if we look back to the New Zealand's case, they had 102 days of 0 numbers for their country, but then they had resurgence happen again after those many days. So for China, and if I may add to this, China has also a very different criteria for counting the new case numbers versus how we do it. For their case, they don't count those people who are asymptomatic. They only count as case numbers who show symptoms and go to hospitals to be checked for it. So in the matter of Chinese declaration that they won against the battle against the COVID-19, I think we have to be more careful, especially as a neighboring country. We have to be very careful watching out for those who are coming in from the country, but also mitigating the spread of the virus within the country.
So China's total tally of infections include only those who test positive and need medical care, and those who are asymptomatic are not included in this tally.
They're not included at this time.
I see. Professor Chu,
Yes.
Let's touch upon now the political and diplomatic implications of Mr. Xi Jinping's claim. What can you tell us?
I guess we can look at it from 2 different perspectives. Obviously, each perspective has its own message. From politically speaking, definitely his declaration of victory, so-called, is to really to confirm the citizens that the CCP leadership remains intact and has a solid control over the situation right now. And as Dr. Kwok said, over the past month or so, they recorded 0 new cases. So taking that as a sign of victory, they want to confirm that the CCP is in good control of the situation, and therefore the people should not be worried anymore. And I guess they want to take the occasion to be a turning point and rallying point of the people going into the second half of the year, so that they can more concentrate on economic development as well as the recovery from the situation. Diplomatically speaking, obviously they want to extend the same message to the outside world, because the virus originated from China, and they want to confirm the case in which CCP is in solid control of the situation, and the world shouldn't be worried about it, and they're seeking cooperation with the world in search of a vaccine and so forth. I guess so they're in the same page to tell the world and to tell its people that CCP leadership is in control.
Right.
Yes.
In a speech that lasted well over an hour, the Chinese leader also claimed that the pandemic had proved, and I quote, superiority of the socialist system with Chinese characteristics, unquote. What are your thoughts on these words?
Well, I guess it depends on the perspective. Definitely if you look at it from outside in, then you go, uh-oh, wait a minute, why are they emphasizing socialism here? But if you look at it from our own situation, our own experience, going back to March and April, when the world was hyping about K quarantine and K testing kit and so forth, it wasn't us that defined the merits and advantage of our system in democratic fashion, or we didn't mention about transparency institution, democratic institution, and so forth. It was the outside world that defined our merits and advantages of our system in contrast to Chinese. Because when the pandemic broke out, obviously, the world was critical of, the way CCP handled the situation. Forced shutdowns, coercive lockdowns, and, they're hammering the doors with nails and so forth. And they closed the entire city of the Wuhan, right? Whereas, we didn't do that with Daegu and so forth. And there, the world, outside world, try to get a better understanding of, what could be done, because Korea and China were the hardest hit countries at the early stage, and obviously they were approaching in a different manner, in a contrasting manner. So I guess that's where the ideology element came in, and now. But Xi Jinping, going back to 2013 when he came into power, his motive and his ultimate goal is to prove to the world that the socialist system is much better than the capitalist system.
Right.
Yeah.
All right, Dr. Kwak, there are some observers who believe that an actual end to the pandemic will only be possible if 60% of the global population is vaccinated or if that population has developed antibodies. Can herd immunity, if achieved, bring an end to the pandemic, in your opinion?
I certainly have my fingers crossed for that. I really hope so. But the 60%, that number actually comes from a theory that if 2 people out of 3 were immune against a certain virus, it will no longer be able to spread through anybody else. It comes from an equation where R0 is equated into. So it's 1 minus 1 over R0. And when we consider R0 to be in between 2 to 3, that becomes somewhere in between 60 and 70%. Unfortunately, I was just looking at MD Anderson's webpage, and they were claiming that we need at least 70% to be immune against the virus. Whether that be 30% or 70%, it's really all in theory. All we can do for now is just keeping physical distance. If we keep the measures and physically block the virus from attacking us, that'll be the only way that we achieve anything at this point. So I think we really need to focus more on how we're going to achieve physical distancing and social distancing at this point.
All right. Professor Chu, having declared an end to the pandemic in its country, China has now put in full gear its vaccine diplomacy to bolster ties with regional partners. Please tell us a bit more about this.
Well, just like I mentioned earlier, obviously, you know, they think that CCP and then China thinks that they have a situation under control in China. And obviously, on the diplomatic front, they want to go outside and to the, in search of seeking cooperation with the vaccine development and so forth. So, and they actually implemented it. If you look at it over the past 2 or 3 weeks, you know, Foreign Minister Wang Yi has been traveling in Europe, and Yang Jiechi is also traveling several countries, visiting several countries, including Korea, and so forth. But to their dismay, whenever they try to extend their hands for, you know, vaccine diplomacy to the outside world, and instead they're welcomed. Instead, they were criticized for their human rights issues and trade issues and Huawei issues and so forth. So at the end of the day, all these, you know, visits by you know, high-ranking officers of China has not been too successful at all. And instead, the world is not willing to yet carry out the so-called vaccine diplomacy, because if they're willing, then they're walking into uncertain territories together, and they want to hold in hands together. But instead, they're taking their own race. And if you look at it, some news release the past couple of days, they're in a race to secure, you know, the vaccines for their own benefit and good. So they're putting up deposits now. For instance, Japan is making, you know, has already put deposit of money for 5 million dosages, and the United States 3 billion. So there's no cooperation, no coordination, no communication between the countries at this time. So I'm really pessimistic about so-called vaccine diplomacy. It's not going to work unless they have excessive amount of vaccines that are available for, sharing with others. Then we can see vaccine diplomacy coming out.
I see. And perhaps it's because of the concern that you have that the UN has called for a multilateral approach to the COVID-19 situation.
That's right.
Dr. Kwak, let's talk a bit about the vaccine development then, staying with that issue. What are the chances, I understand this is a very difficult question, but what are the chances of us seeing a safe and effective vaccine by this Christmas?
Well, I'm not going to put a number on it, but just past week we saw President Trump coming out to say that it might be possible that we have a vaccination ready in 3 to 4 weeks. I'm quite hopeful for that, but I don't think it's too realistic at this point to see any particular vaccination coming out to the private sector to be distributed to the citizens all over the world at this point. If anything comes out, it will first be given to people who are more exposed to the virus, such as the medical personnel or other politicians and whatnot. But there are several vaccinations currently being developed and going into trials number 3 and 2 that have shown some efficacy and effectiveness towards fighting against the virus. So hopefully at least 1 or 2 of them will hopefully pass through all the clinical trials and will be available before the end of this year. But more likely, as Bill Gates also mentioned, that it'll more probably be distributable by early next year.
We'll keep our fingers crossed for that.
I would too.
Professor Chu, one very final brief question. I ask you this because our reporter, our journalist, Yoon Jung-min, mentioned this at the start of the program. Starting from yesterday, international flights from Wuhan have resumed, and the first non-stop overseas route is that to Incheon International Airport. Right. What are your prospects on Korea-China ties?
Korea-China ties. I was really hoping that, last visit by Yang Jiechi would have been much more fruitful. But instead, to our dismay, obviously, his visit was to discuss about, political and security issues rather than focusing on, pandemic cooperation and vaccine cooperation and so forth. So it was quite a disappointing there. But obviously there's a lot of stakes between the two countries in economic terms. So obviously, I hope that charter to Wuhan and other cities in China will facilitate economic cooperation between the two countries.
Right, yes. Professor Chu, we'll keep our fingers crossed for that too.
Yes.
Thank you for your thoughts, and Dr. Kwak, as always, thank you for being with us today.
Thank you.
Right, on that note, we end this edition of COVID-19. Be sure to join us tomorrow as we address the alarming rise in the number of elderly patients of the virus. In the meantime, do share your thoughts with us through our social media accounts. Thank you for being with us.